This is the final worksheet of the blood and respiratory chapter, and we will be covering diseases, just for the people who don't know, because I know you guys are fully aware of what we're doing. So the first two parts of the worksheet cover respiratory and blood diseases. The last part covers cardiac diseases. You do not need to know these for Mark's class. If you were in Janet's class, you would need to know, but don't worry. Yeah, for the diseases. Because you guys aren't on the cardio chapter, so you're not going to be quizzed over cardiac diseases. So, some respiratory system diseases, sinusitis, inflammation of the sinuses, kind of straightforward. Sinus, and then itis is inflammation. Chronic bronchitis is bronchial thickening. This is when your bronchial tubes, so the tubes going to your lungs, get thick and inflamed and irritated. And chronic means it happens like over and over and over again. You never lose it, so that's unfortunate. I'm sorry. The next one, emphysema. Now, I know emphysema is something that some people like to ask about. So typically you have alveoli, which are, air sacs in your lungs. And these really function with, oxygen supply. So when you have a lot of alveoli, you have a lot of surface area, right? And surface area is good. The more surface area you have, the more oxygen and carbon dioxide that can exchange. With emphysema, though, I don't know how to draw surface area. But with emphysema, though, it kind of all clusters up together. And when this happens, the surface area is only around this portion of it, which isn't very much. So emphysema is when the alveoli, and you can probably look up pictures of this, they're probably pretty gross, but you can look up pictures of it if you want. But destruction of the alveolar walls, the loss of alveolar elasticity, and diminishing capillaries, that is emphysema. So I know one of my nursing instructors like to ask about this one a lot. So maybe this is something he would too. Laryngitis. Itis means inflammation. Larynx means the larynx. And this is known as loss of voice. And you can lose your voice over like screaming on a roller coaster or screaming at a concert or maybe even getting sick. Yeah, that kind of stuff. So, bronchial asthma. Now this is asthma in your bronchiole, which is that splitting into your lungs, the bronchial tubes. Bronchial asthma is an allergic reaction, and I believe this is the only allergic reaction of the diseases. This is like when you inhale pollen, you have bronchoconstriction, so your bronchial tubes shut, and you start to wheeze because they're very, very narrow spaces. So that's bronchial asthma. High altitude pulmonary edema. An altitude is like if you were to go up on a mountain. So altitude means very high. This is known as severe altitude sickness. You get sudden headache, vomiting, nausea, rapid heart rate, and you get rapid breathing. And you also get edema and hypoxia vasoconstriction. So you lose oxygen and your veins vasoconstrict, so they get smaller. And it's just very uncomfortable. And this is what happens to some people when they're going up on mountains or traveling. Carbon monoxide poisoning. This is when toxic fumes from smoke, car exhaust, or a furnace. CO2 will bind to hemoglobin more readily than oxygen will, but carbon dioxide will not dissociate, and this can lead to death. So that's not fun. Disorders that impair gas exchange. We have pneumonia, which is a lung infection. Causes the alveoli to swell up, and they turn like edema. This can be caused by Streptococcus pneumoniae bacteria and some viruses, and this decreases the area for gas exchange. So kind of like with the emphysema, when it inflames, you don't have as much surface area. Atelectasis is known as lung. I know, right? It's a tongue twister there. It's known as a lung collapse. This is when the blood vessels collapse within the lung, the alveoli collapse, and can be because of a pneumothorax, a hemothorax, or a ruptured pleura. So pneumothorax is kind of like if you get stabbed and air gets into your lungs, into the space between your lungs and your cavity. That's not good because it throws off the pressure and your lungs will collapse. Hemothorax is like if you get stabbed and you get blood in either your lungs or the cavity. Well, that's not that great either. And a ruptured pleura is like if that pleural membrane ruptures, then it can lead to like gas leak from your lungs. So that's not fun. And it can all lead to lung collapse because your lungs expand and, deflate. But if you rupture something, it's kind of like with a balloon. If you cut it, it's kind of like, it doesn't really, it collapses. TB is a bacterial infection caused from Mycobacterium tuberculosis, formation of tubercles around infections. So if you see something about tubercles, it's tuberculosis. Destroyed surface area. Surface area, again. So if you see that, really important. Acute respiratory distress syndrome, also called hyaline membrane disease, but if you are in nursing, you'll hear this as ARDS, ARDS. This is when your alveoli collapse. The blood vessels and airways narrow, oxygen delivery is impaired, and this most often occurs in premature babies when the lungs cannot inflate. So that's ARDS. Next respiratory disease is pleurisy. And this has to do with inflammation of the pleura due to infection. Because when we have infection, we're going to inflame, right? We want to destroy. So, so inflammation of the pleura due to membrane. This is due to a lack of serous fluid because of the infected cells. And when you don't have that serous fluid, you get a lot of friction because you want that serous fluid to have that, that slippery movement. And it causes friction, it's painful, that's pleurisy, and it's not fun. A pulmonary embolism, we kind of went over what an embolus was. A pulmonary embolism is a blood clot that forms in a blood vessel. This arrives through the pulmonary artery, and this can cause a portion of the lung to be non-functional. By non-functional, it means it can make the lung just not take in any oxygen, and which is bad because if your lung isn't taking in oxygen, that's time. If you have a clot, that needs to be removed as soon as possible because it can damage the lung. And if you only got one lung, you're in trouble, to say the least. So that's pulmonary embolism. Pneumothorax, when air enters the pleural cavity. A cavity is a space between your lung and like your rib cage, kind of. So there's like a space there. When air enters that, it causes your lung to deflate because it puts extra pressure there. This can be caused by a chest puncture wound or anything that damages alveoli, anything that penetrates through the visceral pleura. And this can also lead to atelectasis. Paralysis of breathing muscles. Oh, that should say of breathing muscles, not or. This can caused by injury to the respiratory centers of the brain or nerves and can be caused by polio. So polio can can affect the medulla oblongata or the pons. I think the medulla is more responsible for breathing. And this can affect the respiratory centers in your brain. Another thing too is you have nerves in the back of your neck. So if you get a neck injury, if you know someone and they fell or something, they have a neck injury, don't touch them. Don't let them move because they have nerves in the back of their neck that if those nerves are compressed, then they shut off and you could break them and it's just not fun. So that's what paralysis kind of does. Lung cancer, uncontrollable division of abnormal cells in the lungs. That is cancer. Cancer is when things constantly divide and multiply, and it's just awful. Cancer cells crowd out normal cells, kills them, it suffocates them, and this can be caused by smoking or toxic respiratory irritants, such as like pollution in the air. And that concludes lung stuff. Run through blood. We already went through the anemias, which I would look at again. but we're almost done. So anemia, decrease in red blood cell, many causes. We had a chart over that. HIV infection. This is the HIV infection is HIV virus, which causes AIDS. This causes helper T cells to decrease because HIV attacks helper T cells. The next one is leukemia. Leukemia is cancer of white blood cells, too much white blood cells, nosebleed, fever, bone pain, infection, all these awful things that can happen with leukemia. Thrombus, abnormal blood clot that forms in a blood vessel. So this is like a plaque buildup within it, but a piece of your thrombus can break off and then travel elsewhere in the body, which is in contrast to an embolism, which is a moving blood clot that blocks an organ, such as a lung, which is a pneumothorax. Infarction. Usually you hear of myocardial infarction, and that is a heart attack, because infarction means death, tissue death, all that great stuff. Not great stuff, terrible stuff, sorry.
Not great stuff. Die.
Oh dear, no, please don't die. Lastly, we have atherosclerosis. This is the accumulation of fat in the arterial lining, causes abnormal blood clot in the form of thrombosis. And then you have a deep vein thrombosis, which is a clot due to pooling of stagnant blood. So some stagnant blood forms, and this can occur in the femoral or popliteal veins. The femoral veins are like in your thigh, the popliteal are like behind your knee, and this can lead to a pulmonary embolism once it travels. So pulmonary embolism probably might be on exam if he's asking stuff. Any questions over respiratory and blood diseases? Nope. All right. Well, that concludes everything that we could do today.
Yeah, girl.